Good morning and welcome to the first post on the Wonder of Astrid's YouTube channel. Now, we wanted to set up this YouTube channel to raise awareness of Astrid's condition, as well as kind of get her face out there a little bit, and hopefully to spread a bit of knowledge to people that are a bit earlier on in their journey than we are, and maybe say something or show something that might be useful. So for those of you that don't know us, my name is Harriet and Astrid is my daughter. Astrid is 2 years old. She was 2 on the 4th of January this year. She weighs 11.5 kilos. She was born at 34 weeks via an emergency cesarean section, and turns out that during my pregnancy I had something called a fetal maternal hemorrhage, which meant that the blood from the placenta was going the wrong way, so into me instead of into Astrid, which left her severely anemic. So her brain was deprived of oxygen and blood for a long period of time. We don't know exactly how long. I noticed that she stopped moving in my pregnancy, so I went in to have a check, and out she came. When she was born, she was actually not born alive and needed full resuscitation, and spent 6 weeks in neonatal intensive care, at which point we were told that she has a condition called hypoxic ischemic encephalopathy, which basically means her brain was deprived of oxygen and blood. This is a form of brain injury, so it's something that she will never recover from, and it's known as a life-limiting condition. With otherwise known as HIE, there's different grades, so grade 1 through to 3. Grade 3 is the most severe, which is what Astrid has, and children with HIE can kind of vary along a huge spectrum, but this condition affects Astrid massively. So she has cerebral palsy, which affects all 4 limbs as well as her head control. She has increased tone in her all 4 limbs, so that means that she can be very, very stiff and hard to move, but then she has dramatically decreased tone in her trunk, so kind of her head control, her airway, and kind of like her tummy and her core muscles are really floppy. She also has a condition called dystonia, which is like when her muscles go into spasm and they lock, and she gets stuck in a lot of different positions. So quite often she's like this, and you can see her kind of hand shaking, so that's her dystonia. And she does show dystonia when she's uncomfortable or unhappy. It's kind of like her way of communicating. She also has epilepsy. Now, most people know what that is. Astrid has 4 different types of seizures, and we usually see all of them every day, and it really does kind of depend on what kind of day she's having as to how much her epilepsy affects her during the day. She also has something called microcephaly, which is medical talk for a small head. Now, because she's got brain injury and her brain was severely affected, her brain won't grow as it would in a normal person, and your head growth is triggered by brain growth. So Astrid has a very small head, which at the moment she makes up for with her huge amounts of hair. Moving on, she also has a condition called cerebral visual impairment, CVI, which means that she cannot see very well. We don't know how well she can see. I think she can see better than medical professionals think she can, but I'm not a doctor. So she is registered as severely visually impaired, or blind as it was once known, so I carry a little pass for her to say that she can't see. She also has moderate to severe sensory neuro hearing loss in both ears, so you might see her wearing some hearing aids at some point. We don't wear them all the time because she finds them quite hard, quite overwhelming with sound, so we don't wear them that often. But that basically means that the pathway from her ear to the brain, somewhere along that, her brain isn't receiving the message for sound. So yeah, she can't hear very well either. This means obviously she struggles to communicate. She can't speak, she's non-verbal, and she can't move her hands for sign language or anything like that. So communication is difficult. She also has bilateral hip dysplasia, so that means that her hips aren't in their sockets some of the time, so they kind of pop in and out, and this can cause her a great deal of pain. We are waiting for her to have an operation for have these screwed back in, but because of her other medical complexities, putting her under a general anaesthetic is really high risk, so we can't do that at the moment. She has a very vulnerable chest and airway. We spend a lot of time in hospital for chest infections and airway concerns, whether she's got an unstable airway. We are also waiting on an operation to hopefully have her adenoids removed, because these are abnormally large and can inflame when she has a virus, which can occlude her airway completely. So that is, as it sounds, very scary. She's also peg fed, so Astrid has a button. It's a tube that goes from inside her tummy to outside, and we feed her through the tube. So she doesn't have anything in her mouth, it's all done through this tube, all her water, all her medicines and food. So as you can see, I've listed a lot of different conditions here. So Astrid is very medically complex and has lots of additional needs, which comes with lots of equipment, which comes with lots of medications and lots of life changes for the rest of my family. So I do have another child. I have a son. His name is Otis. He is 3, and my husband as well. And we have a wider family. So her health conditions obviously lead to implications for the rest of the family. So we wanted to set this up just so that we could share some information. I hope this first post was a little bit insightful as to the wonder that is Astrid, and we hope you follow along our journey and maybe learn something. Thanks.